Assalamualaikum. Fluid and electrolytes, balance and disturbance. In objective number 1, it's my task to differentiate between osmosis, diffusion, filtration, and active transport. Osmosis. Osmosis is very similar to diffusion, but just for water, it is the movement of water into or out of the cell. Again, it is the movement from a dilute solution. So, high concentration of water molecules down the concentration gradient to move concentrated solution. So, low concentration of water molecules, the water molecules move across a partially permeable membrane. Water molecules move random. So some do go back across the membrane, but the overall net effect is that there is a movement to move concentrated side, or the side with less water, until the solutions are of equal concentration.
Process by which fluids move from a region of higher concentration to a region of lower concentration through a semi-permeable membrane. Osmosis occurs due to the free energy of the solvent molecule in two regions. The free energy of the solvent of pure water is greater as compared to that present in the solution. So when osmosis occurs, the solvent moves from a region of its high free energy to a region of its low free energy through a semi-permeable membrane.
Tonicity. Tonicity is the ability of all solutes to cause an osmotic driving force that promotes water movement from one compartment to another. It is the ability or it is the capacity of a solution to modify the volume of cell by altering their water content. In osmosis, there are three other terms are associated with osmosis. First, we have osmotic pressure. Second, oncotic pressure. And third, osmotic diuresis. Next, diffusion. So, this is the definition of diffusion. Diffusion is the next movement of anything of region of higher concentration to the region of lower concentration. Diffusion is driven by a gradient in concentration. The concept of diffusion is widely used in many fields. So, like for example, diffusion are the exchange of oxygen and carbon dioxide between the pulmonary capillaries and alveoli, and the tendency of sodium to move the ECP, which is the pulmonary capillaries and alveoli, and the tendency of sodium to move from the ECP, extracellular fluid compartment, where the sodium concentration is high, to ICF, where its concentration is low. The next, filtration. This is the definition of filtration. Filtration also commonly used to separate solid from water. Example, just take a look at this picture. The gravity forces water through the filter paper. water and dissolved particles are forced across a membrane from an area of higher to lower hydrostatic pressure. Hydrostatic pressure, it is the pressure of the blood against the capillaries wall generated by the contraction of heart, pushes the fluid across the capillary membranes into the interstitial fluid. Next, sodium, potassium pumps, and the active transport. The sodium concentration is greater in the ECF, extracellular fluid, than in the ICF, extracellular fluid. Because of this, sodium tends to enter the cell by diffusion. In cellular psychology, a protein that has been identified in many cells that maintain the internal concentration of potassium ions higher than that in the surrounding medium, blood, body fluid, and water. It maintains the internal concentration of sodium ion. Active transport implies that energy must be expended for the movement to occur against a concentration gradient. Active transport is usually associated with accumulating high concentrations of molecules that the cell needs, such as ions, glucose, and amino acids. For example, for active transport include the uptake of glucose in the intestine in human and the uptake of mineral ions into roots, hair cells of plants. That's all, and let's listen to the next reporter.
Assalamualaikum. I'm Hakim Abdul Mumbin. We are going to discuss the second objectives with Mr. Hussein, which is the objectives number 2 is describe the role of kidney, lungs, and endocrine glands in regulating the body fluids composition and volume. So I'll be the one to discuss the role of the kidney. So I'm just focusing on the kidney. So we all know, guys, that kidney it is involved in the urinary system. So kidney it is the one who filters the fluids in our body. So take note. So the kidney it is vital to the regulation of the fluids and electrolyte balance. By the mean of vital, that kidney it is important. It is important to regulate. It is important to the regulation of the fluids and electrolyte balance. So, and also the kidneys, it is normally filter 180 liter of plasma every day in the adult. So 180 liter it is equivalent to a gallons of the fluid filtered by the kidney. So the kidney is so it's very amazing organ in terms of and also very important that must all of us to take care of our kidney. So in adult the it has daily urine volume which is 1 to 2 liter. So ito yung na-excrete urine from our body in 24 hours which is 1 to 2 liter. So now let's proceed to the major function of the kidney. So So in maintaining the normal fluid balance, so we have 4. So number 1 is regulation of ECF, which is extracellular fluids, volume and osmolarity by selective retention and excretion of the body fluids. So the kidney also has a role of regulation of the ECF. So ECF is outside of the cell fluids. It is the extracellular fluids volume that is important and also has a role in maintaining the fluid balance. So next is the number 2 major function of the kidney is the regulation of the normal electrolytes levels in the ECF by selective electrolytes retention and the excretion. So also the kidney has a role of regulation of the normal electrolytes. Then next is the third one is regulation of pH of the ECF by retention of hydrogen ions. So the kidney has also the role of regulation of the pH and the ECF, which is the extracellular fluids, but and also retention of the hydrogen ions. Then last one is excretion of the metabolic waste and toxic substance. So the kidney has a role on eliminating those waste on our body, which is secreted through urination. So that's all the major function of the kidney. So we have, if there is a failure of the kidneys, may result in multiple fluid and electrolytes abnormalities. So that's all.
Okay, let's start with the function of lungs and endocrine glands in regulating body fluids. Hi everyone, so now we are talking about the function of the lungs. We are common of these organs. We are very common of these organs. As we all know that these organs, which is the lungs, is responsible for the respiration or the oxygenation, which is the exchanges of gases when we are breathing. And we are breathing through our mouth and nose every day in our daily life. We are breathing. So, meaning our lungs are working every day. But take note, our topic is about regulation of the fluids. And then the other is the electrolytes. So when we are talking fluids, that's not only the water. We are referring also the electrolytes, bloods, and water, and so on. So we are talking fluids, the regulation of fluids inside our body. Take note that our body is composed for more or less 70% of water. And take note also that we may get electrolytes from our food we eat and from the fluids we intake. And those electrolytes and fluids are needed by those organs in our body, deposited into other organs, different organs in our body to function it well. So that's the another importance of electrolytes and fluids. So what is this lungs? The lungs normally eliminate water vapor insensible loss at a rate of approximately 300 ml every day. So Grossman and Port 2014. What does it mean when we say that? First function of the lungs, which is to eliminate fluids approximately 300 ml a day or every day, and it is called insensible loss. When we say insensible loss, that is what we call this. This is what we call insensible loss, wherein we are not aware that we are losing fluids every day. So means when you lose too much water or fluids and electrolytes, when you are losing fluids too much, you need to intake too much water also to balance your fluids in your body. And when there is an imbalance of fluids, there is an abnormalities of functioning for those organs or those systems that are needing some those fluids to be deposited. So, in case of the lungs helps to eliminate those fluids, those waste fluids. So what are these ways to eliminate fluids? We have sweating, we have vomiting, we have urinating, we have also diarrhea, breathing, one of the most common. We are in insensible loss. We are not aware that through breathing, we are get rid of those fluids. So that's on how the lungs have to eliminate fluids and for the balancing of those fluids and electrolytes in the body. These lungs, the loss is much greater with increased respiratory rate or depth or in a dry climate. And now, what does it mean when you lose too much water and the respiration rate will increase or it will depth? So when we say depth, this is malalim. When you're losing too much water or you are in a dry climate, you are increasing respiration. This is how simple it is. When you are losing too much water, like you are sweating too much. So when you are sweating too much, obviously you are in a hot climate. So when you are in a hot climate, you are working harder. Your lungs are working harder for the respiration and you're using too much oxygen. When you are using too much oxygen, you are receiving also and you are searching also for too much oxygen to be intake. So that's the reason your lungs will work more harder for the respiration. So that's the function of lungs. Another function of lungs. The lungs are also vital in maintaining homeostasis through exhalation. Now we are here, guys. We the other function of lungs, which is the lungs is plays an important role in maintaining those homeostasis. So, as we all know, when we are talking about lungs, obviously it talks about respiratory system or the respiration. So, the lungs is for respiration and it plays a vital role in maintaining homeostasis also. In the body, we all know that in the lungs, the gas exchange is happening. So, the lungs is one of the ways for the respiratory. And another one is lungs and or respiratory system helps maintain homeostasis. So this gaseous exchange of oxygen and carbon dioxide takes into a place wherein alveolar sacs present in the lungs. So the respiratory system or the respiratory centers, which is it controls the rate and the depth of the breathing for the human being, and respond to the chemoreceptor which detect the changing of oxygen or O2 and the carbon dioxide, which is CO2, and the H plus ions levels. This maintains the correct balance of water and carbon dioxide within the blood, and thus maintaining the homeostasis. When you say maintaining homeostasis, there is the balancing of those fluids. Let's go with the homeostatic mechanisms. The body is equipped with remarkable homeostatic mechanisms to keep the composition and volume of body fluid within narrow limits of normal. So, what do you mean by that statement? So, homeostasis mechanisms. This homeostasis is a dynamic process that ensures ideal conditions are well maintained and within living cells. So, we are talking with the living cells when you say homeostasis, in spite of those constant internal and external changes. One of the best examples for this homeostasis, which is for this chemical science behind long distance running. One of the example, a long distance running, which includes how the human body takes in nutrients and expels waste products and uses water to cool the skin and the body or to maintain the body temperature. So, the control of body temperature in human body is a good example of homeostasis. So that's the explanation for the homeostasis mechanisms, because this is involved also in regulation of the body fluids and electrolytes. We have the pituitary function. Pituitary functions, the hypothalamus manufactures ADH, which is stored in the posterior pituitary gland and released as needed to conserve water. Now, what do you mean by that? That hypothalamus produce ADH. So what is this ADH? This ADH is an hormone, which is the antidiuretic hormone. This is the hormone for fluid, which is produced by the brain. ADH also is called as argine or argine vasopressin, or AVP in short or abbreviation. Is a hormone. This is a hormone that helps to regulate water balance in the body by controlling the amount of water, and then amount of water in the kidney. Then reabsorbs water, or reabsorbs while it is filtering and waters out of the blood. So antidiuretic hormone, this is a chemical produced in the brain. So when we say brain, there is the hypothalamus, because as what I've said in the statement, hypothalamus produces the ADH hormone. That causes, when produced in the brain, it causes the kidney to release less water. So when it releases less water, it decreases the amount of the urine. And then vice versa, when it produces a high ADH levels, it causes the body to produce less urine. A low level results in greater urine production. So that's for the anti-diuretic.
Disturbances, hypovolemia or fluid volume deficit. So, fluid output exceeds the fluid intake. Hypovolemia refers to loss of extracellular fluid. Hypovolemia means low of blood volume. Dehydration means loss of water. Untreated hypovolemia can lead to shock. Severe hypovolemia, 40% or more of intravascular volume loss, may lead to hypovolemic shock. Causes of hypovolemia: vomiting, diarrhea, eye dysfunctioning, sweating, decreased fluid intake, third space fluid shift, for example with edema formation in burns, ascites with liver dysfunction. Other causes: internal bleeding, blunt traumatic injury, diabetes insipidus, intestinal obstruction, adrenal insufficiency, osmotic diuresis, hemorrhoids. Fluid volume deficit, sign and symptoms. Early symptoms: headache, nausea, profuse sweating, dizziness, and fatigue. Hypervolemia or fluid volume excess. Hypervolemia, also called fluid overload, a condition in which the liquid portion of the blood or plasma is too high. Hypervolemia is an excess of isotonic fluid, that is water and sodium, and the extracellular compartment. Causes of hypervolemia: diminished homeostatic mechanism, heart failure, cirrhosis, hepatitis, kidney failure, nephrotic syndrome, high salt diet.
Assalamualaikum classmates, I am Marsa Ali Basal, and our report is about is the objective number 3, which is to identify the effects of aging on fluid and electrolytes regulations. So we're going to tackle about the electrolytes imbalances. So electrolytes imbalances, disturbances in electrolyte balances are common in clinical practice and may need to be corrected based on history, physical examination findings, and laboratory values. So what is the symptoms of electrolytes imbalances? So the symptoms are based on which of the electrolytes level are affected. If your body test results indicate an altered potassium, magnesium, sodium, or calcium levels, you may experience muscle spasm, weakness, twitching, or convulsion. So the sodium imbalances. Sodium is the most abundant electrolyte, and the E CF. Its concentrations ranges from 135 to 145 MEq or L. And it is the primary determinant of ECF volume and osmolality. So the sodium has a major role in controlling water distribution through the body. So because it does not easily cross the cell wall membrane, and because of its abundance and high concentration in the body. So with low blood sodium, hyponatremia, the imbalance of water to sodium is caused by one of the three conditions. So which is the evolemic hyponatremia. So this evolemic hyponatremia is a total body water increase, but the body sodium contents stay the same. Then the second is hypervolemic hyponatremia. This hypervolemic hyponatremia is both sodium and water content in the body increased, but the water gain is greater. Next is the sodium deficit hyponatremia. So hyponatremia refers to a serum sodium level that is less than 135 MEq/L. Hyponatremia can present as an acute chronic form. So this acute hyponatremia is commonly the result of a fluid overload in surgical patients. So this chronic hyponatremia naman is seen more frequent in patients outside the hospital setting, has a longer duration, and has less serious neurological sequelae. So next is, what is the common cause of hyponatremia? So the common cause is hyponatremia may occur with normal increased or a decreased extracellular fluid volume. So common causes includes the diuretic use, diarrhea, heart failure, liver disease, and renal disease. Hyponatremia is potentially life-threatening. So next is the water restriction. So this water restriction is patient with normal or excess fluid volume. Hyponatremia is usually treated effectively by restricting fluid. So thus water affects aging. Water keeps your body hydrated and refreshed and help maintain your skin's elasticity. People who drink large amounts of water are less likely to suffer from scars, wrinkles, and soft lines, and they won't show as many signs of aging as those who drink little amounts of water. The next is the sodium excess. Sodium excess hypernatremia. Hypernatremia is a serum sodium level higher than 145 MEq/L. So it can be caused by a gain of sodium in excess of water or by a loss of water in excess of sodium. So in hypernatremia, the level of sodium in blood is too high. Hypernatremia involves dehydration, which can have many causes, including not drinking enough fluids, diarrhea, kidney dysfunctions, and diuretics. So what is the most common cause of hypernatremia? So the most common cause is, although hypernatremia is most often due to water loss, so it can also be caused by the intake of salt without water or the administration of hypertonic sodium solution. So hypernatremia due to water depletion is called dehydration. So next is the potassium imbalances. The potassium imbalances, potassium is the major intracellular electrolytes. In fact, 98% of the body's potassium is inside the cells. The remaining 2% is in the ACF and important in neuromuscular function. Potassium influences both skeletal and cardiac muscle activity. So a potassium level that is too high or too low can be serious abnormal potassium level. May occur symptoms such as muscle cramps or weakness, nausea, diarrhea, frequent urination, dehydration, low blood pressure, confusion, irritability, paralysis, and changes in heart rhythm. So what can happen if your potassium level is too low? So in hypokalemia, the level of potassium in blood is so low. A low potassium level has many causes, but usually result from vomiting, diarrhea, adrenal gland disorders, or use of diuretics. A low potassium level can make muscles feel weak, cramp, twitch, or even become paralyzed, and abnormal heart rhythm may develop. Then, number 6 is the potassium deficit. The potassium deficit hypokalemia. Hypokalemia serum potassium level below 3.5 MEq/L usually indicates a deficit in total potassium stores. So, hypokalemia is an electrolyte characterized by low serum potassium concentration. Normal range is the 3.5 to 5.0 MEq/L. Severe and life-threatening hypokalemia is defined when potassium levels are less than 2.5 MEq/L. So what are the symptoms of the potassium deficiency? So a small drops and potassium level often does not cause symptoms, which may be mild and may include the constipation, feeling of skip heartbeat or palpitations, fatigue, muscle damage, muscle weakness or spasms, tingling or numbness. Then the potassium excess, hyperkalemia. Hyperkalemia serum potassium level greater than 5 MEq/L seldom occur in patients with normal renal function. Hyperkalemia occur when potassium levels in your body get too high. So potassium is an essential nutrient, helps your nerves and muscles functions. But too much potassium in your body can damage your heart and cause a heart attack. So 8 is the calcium imbalances. Calcium imbalances, more than 99% of the body's calcium is located in the skeletal system. So it is a major component of bones and teeth. So, hypokalemia is an electrolyte imbalances, and it indicates by a low level of calcium in the body. So the normal adult value for calcium is 4.5 to 5.5 MEq/L. Then the calcium deficit. Calcium deficit hypocalcemia. Hypocalcemia serum calcium value lower than 8.6 or DL occur in a variety of clinical situations. A patient may have a total body calcium deficit as in osteoporosis, but a normal serum calcium level. So, hypocalcemia, also known as calcium deficiency disease, occur when the blood has low level of calcium. A long-term calcium deficiency can lead to dental changes, cataracts, alterations in the brain, and osteoporosis, which causes the bone to become brittle. And a calcium deficiency may cause no early symptoms. Then the calcium excess, hypercalcemia. Hypercalcemia, serum calcium volume greater than 10.2 mg/L is a dangerous imbalance when severe. Then in fact, a hypercalcemia crisis has a mortality rate as high as 50% is not treated promptly. So hypercalcemia is a condition in which the calcium level in your blood is above normal. So too much calcium in your body, in your blood rather, can weaken your bones, create kidney stones, and interfere with how your heart and brain works. So hypercalcemia is usually a result of overactive parathyroid glands. So that's all from my report.
Assalamualaikum, I'm Miss Norfaisal Mentano. I'm going to explain the magnesium imbalances, phosphorus imbalance, and the chloride imbalance. So I'm going to explain the number 1, magnesium imbalance. Magnesium imbalance is an abundant intracellular cation. So it acts as an activator for many intracellular enzyme system and plays a role in both carbohydrates and protein metabolism. The natural serum magnesium level is 1.3 to 2.3 mg and 0.62 to 0.95. So approximately 1/3 of serum magnesium is bound to protein. Its remaining 2/3 exist precations the active component magnesium. So I'm going to explain the next magnesium. Okay, I'm going to explain the magnesium deficit. So the hypomagnesemia. So hypomagnesemia it refers to a below normal serum magnesium concentration to 1.3 mg to 0.62 and is frequently associated with hypokalemia and hyposalemia. So, magnesium is similar to calcium in two aspects. Number 1, it is the ionized fractions of magnesium that is primarily involved in neuromuscular activity and other psychologic process. And number 2, magnesium level should be evaluated in combination with albumin levels. Okay? Because about 30% of magnesium is protein bound. Participating to albumin, a decreased serum albumin level can be reduced to the measured total magnesium concentration. However, it does reduce the ionized plasma magnesium concentration. So I'm going to explain the next magnesium excess. Magnesium excess hypermagnesemia. Hypermagnesemia is a serum magnesium level with higher than 3.0 mg to 1.25. A serum magnesium level can appear falsely elevated if blood specimens are allowed to hemolyze or are drawn from extremity with a tourniquet that was applied too tightly. The most common cause of hypersemia is kidney injury. Haban in fact is most patients with advanced kidney injury have at least a slight elevation in serum magnesium levels. I'm going to explain the next is the phosphorus imbalance. Phosphorus is a critical constituent of all body tissues. So, it is essential to the functions of muscle and red blood cells. The informations of adenosine, triphosphate, and of 2 to 3 disphosphoglycerate, which is the facilitates the release of oxygen from hemoglobin and maintenance of acid-base balance, as well as the nervous system and intermediary metabolism of carbohydrates, protein, and fat. It provides structural support to bones and teeth. Phosphorus is the primary anion of the ICF, About 85% of phosphorus is located in bones and teeth, 14% in soft tissue, and less than 1% in the CCF. to explain the last part is the chloride excess. Chloride excess, hyperchloremia. Hyperchloremia exists when the serum level of chloride exists. Hypernatremia, bicarbonate loss, and metabolic acidosis can occur with high chloride levels. High serum chloride levels are almost exclusively a result of iatrogenically induced chloramite metabolic acidosis stemming from excessive administration of chloride relative to sodium, most commonly as 0.9%, normal solutions 0.45%, normal saline solution, or lactated vinegar solution. This condition can also be caused by the loss bicarbonate ions via the kidney or the GI tract, with the corresponding increase. The chloride occurs with a decrease in bicarbonate ions. Head trauma, increased perspiration, exists adrenocortical hormones productions, and decreased glomerular filtration can lead to a high serum chloride level. Okay, I'm going to explain the last part. Gerontology considerations of our topic. Normal psychologic changes of aging, including reduced cardiac, renal, and respiratory function, and reserve as alterations in the ratio of body fluids to muscle mass. May alter older adults' responses to fluid and electrolytes changes and acid-base disturbances, decreased respiratory function, cause impaired pH regulation in older adults with major illness or trauma. Renal functions declines with age, as do muscle mass and daily exogenous creatinine production. Therefore, high normal and minimally elevated serum creatinine values may indicate substantially reduced renal functions in older adults. Because of a decrease in age-related muscle mass, older adults have a lower concentrations of body fluid and may alter the psychologic responses.